Welcome to Health Talk. Thank you very much for joining us today. Our topic today is healthcare. Are there cybersecurity risks? We're really pleased to have with us today Ms. Keesha Crosby. She's founder and CEO of Triguard Risk Solutions from Fairfax, Virginia. And she's a specialist in cybersecurity. She's a professional in that area, has participated in many industry standards, and is well known in that field. So thank you for joining us. And we also have Kevin Liu, who is applying to medical school. He's interested in the future of healthcare, and obviously cybersecurity is part of that. So Keesha, tell me, we talked about cybersecurity. So I know there's standards, and there's the FDA and the National Institute of Standards and Technology. Tell us a little bit about that and how it plays in cybersecurity regulations.
Okay. So NIST, National Institute of Standards and Technology, works hand in hand with all the federal government, both FDA and HIPAA and HHS. All of those standards tend to work together because NIST is the foundation.
So HIPAA is the Health Insurance Portability and Accountability Act, passed in 1996.
Correct.
And the other part you were talking about was, HHS is Health and Human Services, and that's Medicare. Medicare is a big insurance that covers everybody over age 65 in America. So go on, yes.
Yes, so HHS also has CDC, and it has as well as CDC, the
Center for Disease Control
and National Institute of Health.
Yeah, the National Institute of Health funds all the research for cancer, heart, diabetes in America. So obviously these guidelines cover many things, not only federal government, but many citizens.
Correct.
Yeah. So tell us a little bit about how we, the consumer, the patient, we, the doctor, how are we affected by these standards? What if there were none? It'd be worse.
Yeah, it would definitely be worse. Actually, it's the vendors and the healthcare providers, as well as the manufacturer of medical devices, that had to meet those minimum security standards, and hospitals as well. Hospitals need to meet HIPAA and as well as NIST standards, because HIPAA is the health privacy and the security portions for protecting medical records and anything having to do with patient care and such on, and more than that, really.
Yeah, and so HIPAA also affects everybody, because whenever we see a doctor or a hospital, they make you sign something saying that they are aware that the hospital or the doctor is not selling their information, that's totally private. However, as you all know, everyone who reads the newspapers, the hospitals have been breached, and Blue Cross Blue Shield has been breached, and so pieces of information got out. So how does that happen? How does somebody mean and nasty hack into something like as big as a hospital, which is supposed to have all these security things? Tell us, what are the loopholes?
Well, a lot of times it's how you install those devices in your network. How do you make sure that your patients, your doctors, and any individual, whether they're your med techs and stuff, have access to that hospital network? Are they wirelessly connected? Are they hard, into the network? Do they have email addresses? Those kind of things. We're giving them access, but we're not forming the security around the access. And so some of the regulations and guidelines and, standards help to match that, meet that minimum security standard.
So for example, I have an electronic health record in my office, and it's called eClinicalWorks. And I remember when we set it up in 2014, we had to connect the fax machine. So we called the company, and Kevin knows that when you connect the fax machine, we call them, and it has to have protection. So that took like a day for the company to interface with us. And I know, having been chief of surgery, that when vendors lend us a microscope for 90 days, that too is connected
to the vendor,
into the hospital system. So you have a vendor A lends the hospital for free for 90 days a $100,000 microscope for us to operate and use to see if we will buy it. Meanwhile, the vendor gets all the information about the patient,
Use.
about the surgeon, how we operate, how many cases we did, the time it takes for us to operate, everything. And we don't know what happens to that
Data. Mm-hmm.
So the hospital, unfortunately, usually they don't have they have a chief information officer, but they don't have, as you said, a chief information security officer. Tell us, what would these two people do? If you have a CIO, which is chief information officer, and a chief information security officer, what's the difference?
So a CIO would be heading your networks, replenishing your equipment, you know, making sure your routers, you have the right routers and
That things
routers
go
and-
move smoothly.
Yeah, so your infrastructure is functioning, and that you that your medical devices are into the network, and you have the, you know, connecting pieces like hubs or different connecting pieces that you would need to make sure. So he's infrastructure, big picture purchasing of equipment, whereas the CISO is really looking at what are the security implications of using that device, of connecting it into our existing network that we have secured at some level of security.
Now, it seems that I do know that every time we want to bring in our piece of device, equipment, into the operating room, we have to clear it with IT. So this is a step that hospitals try to make sure that, number one, we don't burn out their electrical outlet, that we have to know what
You have enough
voltage it
power.
is. I mean, that's the very simple thing. But the more complex thing is that the security of that, the cybersecurity. That's very interesting. The other thing is that we're talking about ways that if you're a criminal, you want to hack in. Now, the reason why criminals want to hack in is money,
Right.
you know. And tell us about the ways that they could hack in, break into a system.
Well, there's a lot of ways they can do it, but there's pretty much broad categories. And, you know, Kevin, you can jump in if you want, which are configuration errors, there are software vulnerabilities, there are also phishing and insider threat.
Tell us about phishing. You had an interest about that. A millennial. You're a millennial, so you all know about this.
So I feel like a lot of people have experienced phishing. So I wanted to pose a question to the home audience. What do you think is the most important password you have? And so most people would say, oh, my most important password is to my laptop or to my bank account. But actually, your most important password is your email. And even though it seems like, oh, like my email, like I made that account for free. What information could be on my email?
A lot.
Exactly. So a lot of your accounts, your bank account, your work email, is connected to your email. So as a result, you can reset the password to your bank account, and if a hacker has access to your email, then they can reset your bank account password and gain access to your bank account. And so that's why phishing is becoming more prevalent in cybersecurity. So phishing, traditionally, we think phishing would be, oh, I received a spam email from a Nigerian prince requesting
Money.
a wire of $100,000, right? That's the
That's so
traditional
true.
thought.
Yeah.
But now, hackers are becoming more. They seem more trustworthy. For example, so I work in a medical office, and so when I was scrolling through our work email, I saw an email asking, since apparently the email stated that the email servers were migrating, and they needed your information to make sure that you're still using the email.
Right, give me your password.
Right.
Exactly.
Or sign in.
Sign in.
Or if you sign in, we'll fix you for free.
Yeah.
Wrong.
Right. And then you're stuck, and somebody has access, like John Podesta had access to the email.
Right. And also, another way that people hack is look at Snowden. Like, so
Insider
this is
threat.
an insider threat. So a person has ability and authority and access and is known to have access, but nobody watches this person who has access, and they're mad at the system. and they give away all the information. This happened at Tesla as well.
Yes, it did.
You know, an unhappy employee, and they got Tesla in trouble.
Yes.
And so all this is insider threat. So something, so not only a criminal, but someone who's angry at some part of the system, the employer, the big system, unfairness, their pay raise, or whatever. You mentioned another one. What's another one that you talked about?
So yeah, when you were talking about Tesla, that was an employee who gave away the code
Yes.
to the car. Yeah, he just gave it away. And
To the dark web, sold it,
yeah,
and then
pretty much, yep.
got Tesla in trouble. They had to spend lots of money to get
Fix
it
their
back.
software weaknesses.
Right. And so does your company help things before they go to market? Devices? Tell us a little bit about that.
Yeah, so my company's specialty is software assurance, software security. And our main focus is develop products that can secure software. And that's what we do. We look for what are the software weaknesses before you deploy it to operations so they don't become vulnerabilities.
So so tell us a little bit about vulnerability and a weakness. So let's say you have a electronic health record, and it is simple in the sense that it's only meant for a 2-doctor office versus one that's meant for 1,000 doctors, one that's for 60,000 doctors. So I'm sure the weakness can be exploited more if they don't change, right? Depending on the user interface. So tell us a little bit about that.
Well, weaknesses, and they mostly are in software. So weaknesses are bugs, defects, flaws, and would you like to?
Yeah, I would like to add on to that. I think a major weakness, especially with medical devices, is that since the FDA approval process takes a while, the operating system that these devices begin with, after they are approved by FDA, they may be obsolete. They may have some kind of defect. So a lot of these devices that we're using, they might be on outdated operating systems, and as a result, they're more vulnerable. They're more vulnerable to hacking.
Is that true? It's usually at least a year, right?
So, okay, weaknesses, you can find them in software. Weaknesses tend to become your zero-day attacks. Vulnerabilities are weakness plus an error that causes a vulnerability. Just like a person may be allergic to peanuts, right? Peanuts is that person's weakness. The introduction of peanuts into their system causes the vulnerability of the hives, the not breathing, the have to take the EpiPen. And that's the same thing with software and systems.
Now, you've dealt with companies that go to market and all that. What's the shortest time if it's a software operated device for FDA? At least a year. It's not.
Oh, sometimes it takes a couple of years.
So during that time, as you say, things can become obsolete because people are constantly changing the program, modifying, and
code, yes.
some software for mobile devices or mobile apps are on freeware. So that's
Yeah.
even worse.
Open source.
Open source. That means anybody from Czech Republic, from the dark
Anywhere.
web, Russia,
Yes.
can just do anything they want.
Yes.
So that's very interesting.
Yeah, well, with like a Abbott Technologies or Philips or GE, that's a closed system. So that source code is not going to be readily available to anybody. But when you're using stuff like Argonne National Labs, which is funded by the government, they might put open source, software out there, and you might use that code base into your commercial product. But how do you know if that code base is secure?
Wow, that's interesting. Does your company help with that?
Yeah, we actually evaluate the code, look at the code, and say, hey, we found these, or we can use other vendors like Fortify or Vercode or Pearsoft or something, and we could take their output from static or dynamic analysis, which is how you look at the code. What's the code you're actually using? And it identifies what are the weaknesses by the line number. And we say, hey, let's take that output and put it to government standards. And if you don't fix this line number 37 with a SQL injection on it, then it becomes an actual vulnerability in operations. And we actually pair that to compliance standards to force them to fix it.
Well, that's excellent.
Yeah.
So no wonder you're popular in your
Thanks.
industry. Now, when we're talking about vulnerabilities and weaknesses and how to hack, there were 4 things: social engineering,
Yes.
putting a device into the system, like adding a fax machine into electronic health records, and what were the other?
So social engineering would be your phishing,
Yes.
as Kevin talked about. And then it would also be, let me call somebody up and see if I can get their password on the phone.
Oh, that's scary.
Yeah, that's very scary. And people do it all the time. Or they see Kevin's badge at work and let me reproduce it so I can become an authentic person at that building.
People have done that.
Yes.
They have,
Yes.
which is very scary in Silicon Valley. People have done that.
Yeah.
Especially since a lot of our personal information is on the internet, so a hacker could potentially gain information about you. So when they call you, they know your name, they know where you're at, they know a lot of things about you. So as a result, it's easy to trust someone that you don't know, and you might, as a result, give sensitive information.
Yes, that's so true. And a lot of time, if we're doing 25% is social engineering, and these are not actual fact numbers, but let's just, for the sake of this conversation, say 25% is social engineering, 25% is configuration errors, installing a piece of equipment wrong, giving inappropriate access to the vendor or someone that has access to that equipment. And then software vulnerabilities are actually embedded into the flaws, the weakness, the defects into the actual code that we as consumers don't have access to. So we're relying on the vendor to constantly send us updates and patches. And then I guess the last one would be your insider threat, a rogue employee, just mad for whatever reason. You had blue shoes on today, and they want to come in and make sure everybody's upset or send out information to make the network weak or that software that's inside that car, vulnerable.
So in terms of 50% are things that involve humans, like rogue employee, the insider threat. That's a human person
Yeah,
having.
those aren't actual statistical numbers, but
Right,
yeah.
right, but
For this
one of
conversation,
this, yes,
yeah.
for one of these issues in hacking.
Yeah.
And the other one is the social engineering, the phishing attacks, the ransomware, the malware, seeing a zip drive on an empty desk, and you're a hospital employee, and you innocently put it in. Meanwhile, you infected the system.
Correct.
And or you're a hospital employee, you're on the system, and you download somebody's picture, and
Yeah.
that picture, kaboom, is really a virus.
Right, or executable, yes.
Or it's something that goes into your system, becomes ransomware, shuts the system down, which has happened to 2 medical systems, big medical systems, in the East Coast a couple years ago, and even Los Angeles. And so this is very interesting. So part of it, you had mentioned that there is like software hygiene, like washing our hands. This is like teaching our employees, our coworkers, our colleagues, all the people close to us.
Vendors.
Yes, everybody. Like, don't pick up the zip drive, don't put it in.
Yeah.
Don't win the $1,000 on the company
Yeah.
computer, open up something. Don't surf the internet while you're on company time, because that surfing, while innocent, has viruses.
Yeah.
And that the software, the proprietary software, Epic or whatever large software company that runs the electronic medical records, is proprietary, and it's sort of locked into the thing. And so while you're surfing and you open up something, it infects it. So
Yeah,
do you
you
have
could
any,
just-
yes, you want to say something?
And I think the biggest risk isn't necessarily going on Facebook or YouTube at work, even though you shouldn't be. You
Right.
should be productive.
Right.
The biggest risk is going on links that you don't know where it will direct you. sometimes hackers, what they would do is they would register a domain, a web address, and they would just change one letter in the web address. So you would think that you'd be going on the official website, but in reality, you're going into a domain that the hacker has listed, and as a result, if you type in your information, they would know everything. For example, they could change from a web address two N's into a M. And if you're a elderly and you're on the internet, you might not notice that because that small change will end up in a big result, which is your information being at risk.
Correct.
It's correct. You know, some of the people who want to hack into healthcare, they do change one, or they put a number 1 after it, or they'll say Stanford.edu or MayoClinic.edu, but it's some fictitious name
Yes.
at there, and they have a link, and there's like a number 1 or some other sign. You have to read it carefully.
You do, definitely.
Yeah, and then sometimes they even put the logo of the famous hospital, but the URL address is abnormal. So you actually have to put your reading glasses on
To make sure.
and study it.
But even more on that same note is like, you know this extension of your bank, is it .com or is it .org? And then they'll own the .com, but your bank will use the .org.
It's very interesting.
Yeah.
Right. Nonprofits will be .edu for a medical center, and .org if it's a nonprofit organization like the American Heart Association. But sometimes the rogue criminals will do .net or .us or
.tv.
Yeah. So you have to watch how it ends.
Yeah, you can't just trust the middle.
We could be teaching our cyber criminals out there how to be better. No, just joking. Goes
Hope
both
not.
ways.
But they probably already know this.
Yes, yeah. We should have them on the show.
No.
But it is a big billion-dollar industry, and there are lives that can be hurt if they shut down a hospital software system. Then emergency rooms have been shut down. They can't access their Pyxis, which is the internal software of all hospitals to get drugs dispensed from cabinets. So you can't open up the drug cabinet to give life-saving drugs if you have malware. So that's how they shut down hospital systems, because all the pharmaceuticals for all the cancer patients in-house are shut down, and people have to have a key, a software key to open it up when there's a ransomware attack.
Oh, wow.
So that this is what happened in last year and the year before in major hospital systems. So that's why one hospital system out of Washington, D.C., Columbia Healthcare, they were shut down for a week. They couldn't even take people in the ER. They had to divert them. So even though it sounds simple and silly, but the ramifications are quite big. Tell us a little bit about more about some of the technology standards you worked with.
Oh, okay. So I have worked with NIST. Actually, NIST 853 Rev 5. You'll find my name in there because we changed the way they did the controls. They took away the actual organization and information system and made the controls more blanket. So you can make a choice on whether it's the information system software or organization to use it. And then I also wrote 800-160 Appendix J, the first ever software assurance controls with University of Nebraska.
So this is for all medical devices?
It's actually for anything that under the Federal Information Management Security Act, FISMA, so I said it wrong, Federal Information Security Management Act. FISMA is in charge of all of the government, any vendors that sell to the government, anybody that works with the government, any contractor. So FISMA is the minimum security requirements for securing the government system, and this is in charge of those actual standards,
the
guidelines.
National Institute of Standards and Technology, yes.
Correct.
Yeah. So that's very exciting.
Yeah.
So we have just to call on Keesha Crosby when we have a problem, which involves big systems. But for our home audience, it seems that our take-home message is that there are things that you can be aware of. And if you work in a larger organization, be careful of your password. Don't give it out to anybody on the telephone, even though they sound like it's your favorite Uncle Sam or Uncle, Ben or Uncle Tom, Uncle Henry, or your favorite Aunt Mary. And people act like your friend. They act like they really want to know and that they're helping you.
Right.
Yes, I am helping you. Help me help you.
Right.
Give me your password so I can help you. And then it turns out to be a phishing scheme.
Yes.
So be aware and find out everything you know about your medical device if you're wearing a pacemaker. And if you are a patient, what we're going to do for you as a patient, and read the instructions, ask. And if there are any questions, ask your healthcare provider. There is an IT desk for every hospital. There is a chief information officer for every hospital. And call. And if you like this show for the home audience, contribute to KSAR TV in West Valley College. And we're so happy to have Keesha Crosby with us, Kevin Liu. And thank you for joining us today, and we hope you come back and see this show.
All right, great. Thank you for having us.